the lower first molar, and this is flapless. So again, first we go to Blue Sky Plan implant planning software. You get the cross-sectional, axial, panoramic view and the 3D. It would size the abutment as a molar, 10 millimeters in this case, and use the abutment as a virtual tooth. In this case, we went to the cross-sectional view. We didn't have an opposing model, but we had a little piece of the opposing molar in the scan, and that enabled us to get some orientation toward the lingual cusp of that upper molar. You also can see faintly here the outline of the gingiva. So we have some sense of the depth of the gingiva over the implant. When you go into the 3D reconstruction, you can get an image, a 3D reconstruction of the patient's osseous anatomy. And if you toggle the density threshold, you can then get rid of the bone and see the roots of the tooth. And this is a very powerful tool. So you can see the relationship of your implant to adjacent roots. I might note that this menu here allows you to select a centered model, a model with markers, or the patient, or an articulated model, depending upon what has been scanned in. So you get this really enormous amount of enhanced aids for doing planning using Blue Sky Plan. So if you go to the 3D screen and you view model with markers, then you get the model with the marker indicating the ideal implant position. And then you can look at that and see if the center line of your implant is coming through the ideal insertion point. And you look at it from the buccal, you can look at it from the distal in order to get a sense of what your alignment is relative to the adjacent teeth. Then you can use the abutment as a virtual tooth. And then you do the case. And again, when we do the case, as review, we create a bleeding point. And that bleeding point is an insertion point analogous to the bottom of a tube. The ThinLayer guide that's placed at the occlusal surface level, that's analogous to the top of the guide tube. And together, sequentially, they define your implant trajectory. So we go in an angled entry. This is a first molar, and there were some vertical issues. Stand the drill up, go to depth. It was a flapless case, so we used a punch. Again, with each sequential drill, we did the same thing. Angled entry, stand it up, drop into depth, and you can see here the finished osteotomy with the guide hole from the ThinLayer guide. When you compare the tube guide to the ThinLayer guide, you can see the difference in that the stacking over here adds 7, 8, 9 millimeters vertical clearance. Here you go in at an angle, and you can see the relationship between the back of the handpiece and the teeth. Here we go in, and there's room to do it. Here, you have a problem. So when we take a look at the completed case, you can see the position of the osteotomy. The implant is placed through the guide hole, and if you look at the views on the bottom, you can see that this implant is placed in an ideal prosthetic position.